The infraorbital nerve is the name given to the maxillary nerve after it enters the infraorbital canal. The infraorbital nerve exits the skull through the infraorbital foramen, which is 10 mm inferior to the orbital rim. The infraorbital foramen lies along a line parallel to the midline that passes through the pupil and the corner of the mouth. The infraorbital nerve gives sensory innervation to the midface. This includes the side of the nose, the lower eyelid, the upper lip, and the part of the cheek between the lower eyelid and the upper lip. The anterior superior-alveolar nerve branches from the infraorbital nerve before it exits the infraorbital foramen. So during infraorbital nerve block, most patients will manifest anesthesia of the anterior teeth and gum, making the technique also useful for dental procedures. Infraorbital nerve block is indicated for anesthesia and postoperative analgesia for surgeries involving the midface. This includes procedures involving the following: the upper lip, the lateral part of the nose, the lower eyelid, the medial part of the cheek, the upper central incisors, the canine, and the maxillary premolars. Unlike local tissue infiltration, infraorbital nerve block can provide anesthesia without causing tissue distortion. Therefore, the infraorbital nerve block is a convenient alternative for situations such as facial lacerations in which tissue distortion due to local anesthetic infiltration would be unacceptable. A gauze soaked with local anesthetic is applied for 1 minute for topical anesthesia. Ask the patient to occlude his teeth to identify the landmarks: the upper central incisors, the canine, and the first maxillary premolar. The upper lip is retracted upwards and laterally to expose the buccal gingival fold opposite the first maxillary premolar. The needle is inserted in the apex of the buccal gingival fold, parallel to the long axis of the first maxillary premolar and directed towards the infraorbital foramen. The thumb of the free hand is kept over the infraorbital foramen to help guide the needle and to prevent its inadvertent advancement into the orbital cavity.